the future perspectives looks very good. But also, I think that we should look also what is currently going on in the European countries regarding the association of the diagnosis and also with the treatment. And in order to find much more interesting information on this part, I'd like to give the floor to Professor Aspen to tell us a few words about a very interesting study about the treatment and how the treatment is perceived and how the treatment is linked together with testing, with genetic testing. Thank you.
Hello again, and thank you for the question. Yes, as you can see in the document that have been given to you, 2 years ago, we prepared an article looking for how the pricing and reimbursement of the test for personalized medicine. We know and we are really familiar that there is a strict control, there is a strict price regulation of medicine. So we wanted to know what happened with diagnostic tests. We was really surprised because in most of the countries in Europe, there is no price regulation for diagnostic tests. There is a very strong regulation for the medicine, but not for diagnostic tests. This is the first conclusion that we got. Because in some countries, thinking again in the Spanish country, is medical devices. And normally in medical devices, there is no price regulation. This is the first conclusion. The second one is, and it was also really surprising for us, is in some countries, the manufacturer, the manufacturer of the medicine is given for free to the hospital the diagnostic test. Because, you know, the reason because he's given for free is because a positive in diagnostic test means that the hospital is going to buy the medicine. So it was really impossible to know the price of the diagnostic test. It was really impossible. It was very easy to get the pricing of in this case, we were discussing with trastuzumab, breast cancer, and we see how the price of trastuzumab went down from 2005 to 2013. So we know how the price went down, but it was really impossible to get the price of diagnostic tests. We got some small sample. What was also really surprising is in some countries in Europe, this diagnostic test and this medicine is covered in the hospital setting. So yes, people go to the hospital, make the diagnostic test, is positive, they are given the treatment. But in some other country, there is the diagnostic test is given in the hospital setting, but the medicine is covered by the insurance company or the insurance firm. So sometimes there is no really coordination. I think that we have to discuss that in the future. So because first, we are really worried about the price of the medicine, and we have been discussing previously in the previous panel. But in this case, when we are discussing about the efficacy, I think Australia is one of the few countries when we were making the evaluation, probably UK also, but for sure Australia was the only country that make the pricing and reimbursement of the treatment package. So they're making the assessment for all together, diagnostic test plus medicine. I think that we have to think in that in the future, because when we are looking for the efficacy, in this case, we are looking for the efficacy together, because the efficacy is when there is a positive test. Otherwise, there is no treatment. I know for sure this is the Spanish case where if you need to want to have access to the treatment, you need to have a positive test. So thinking and giving it the ideas for STA and so on, probably we need my proposal. It was one of the conclusions of the article. We have to think in regulation also the price of some medical devices, probably not all, but for sure this one. And secondly, I'm thinking STA that right now in Romania is emerging, thinking to make assessment of all the package together. And probably this is the best way to get a single price for both for the package. Thank you.